Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Hey, Healthcare Boulevard fans, we are on another chapter and we are starting with an interview with a well known, very rounded dentist that I'm excited to chat with today. Um, I don't want to butcher your name. Is it Annie? I'm already messing it up. Am I not? Is it
Okay, you can
Aniruda? Aniruda?
it's called Anirudh. That's how you pronounce it. Yeah.
Aniruda. Okay. All right. So he is a dentist here. But unlike some of our paths, he's path of dentistry study in India. So I'll have him introduce himself and we'll take it from there. Please welcome Aniruda and how are you doing today?
Uh, Hi, Sanand. Thanks for the lovely introduction. I'm doing well, thanks. And to introduce myself, I am a dentist. I practice in the Central Valley region of California in a community clinic. I've been working here for almost 3 years. I'm an internationally trained dentist. I am from India. I did my education in dentistry in India, and then I moved here around 8 years ago. I did some certificate training programs at UCLA, and then it's a very cumbersome process to get accepted to the dental schools. So I got into an accelerated DDS program. You become a dentist after completing the DDS degree, which is usually 3 to 4 years.
Mhm.
And for internationally trained dentists, it is 2 to 3 years, depending on which school you go to. So I completed and finished that in San Francisco at University of Pacific, Arthur Dugoni School of Dentistry. And yeah, after that, I've been working as a dentist.
Okay. How do you like being a dentist? Which is like a very simple question, but
I love it. I am very happy with the, mostly it's the patients that drive you.
mm,
Uh, you know, it's a very generic answer, but yes, relieving people from dental pain it's very good in helping people with their oral health, and how oral health has an important factor in the quality of life
mhm,
of the individuals is good, and that motivates you. And on top of that, it's also to see the change when you see the patients, having a lot of decay or oral health problems, and overall, they take good care of their health, and they improve, and they also improve in other aspects. Usually, if you have a lot of bad oral health issues, they are concomitant with a lot of uh, general health also. And we work with the medical clinic also in our community clinic setting,
mhm.
which also kind of gives me the opportunity to work with medically complex patients. So yeah, that's the thing that I really like about dentistry.
Okay.
And my special focus is restorative dentistry.
Mhm.
That's doing the fillings and you know crowns and bridges. That's something that I really like.
Okay, so that seems like a specialty. Is that restorative dentistry is a specialty that you have to learn a little bit more about after?
Not really. It's not a specialty. It's all the general dentists do it. I
Okay.
just at this point of time, I really like doing it, and I did get some special training in that for a year at UCLA
Okay.
before I got into DDS, and I also worked as a research associate in restorative dentistry at
Mm,
UCLA for a year, and I did a lot of research. And yes, I did a lot of research too. I do a lot of research in evidence-based dentistry,
Mhm.
evidence-based medicine. You might have heard of Cochrane collaboration. I did five reviews, Cochrane reviews,
Okay.
and I did a lot of primary research too in dental materials. So that part actually comes to the that part, and I also happened to, when I was in India, I also started my nonprofit called
Mhm.
Oral Cancer Organization, and I did a lot of work in public health too. I was a faculty for almost you can say almost a year
Okay.
in public health and restorative dentistry in two separate colleges.
Mhm.
And I did set up school oral health programs. I did a lot of I took up a lot of challenges, I would say.
Mhm.
So yeah.
Now, what got you into dentistry when, however many years ago you decided to go into choose your career? How was that process?
So in India, we all go pretty young into what we select. The professional college starts right away after your high school.
Okay.
In high school, when I was 15, I had to decide if I'm going towards the medical field or engineering field, or you have to take up subjects that are the prerequisites to go forth from there.
Mhm.
And right after your high school, which is 2 years later, you have to get into the professional college. So a lot of people do take a break. They, not a lot, a few, I would say, sorry. And then my father was a pediatric surgeon. He was in the medical field,
Okay.
and he did suggest, and I also saw around me there were his friends who were doing well
Mhm.
in dentistry, and he wanted me to pursue either medical or dental.
Mhm.
And you give a lot of entrance exams, and you get into the school, and you do pretty much all your prerequisites in the professional degree.
Mhm.
So you learn a lot. I mean, you don't do real dentistry until your second or third year. In the first year, you're just doing anatomy and all the basic stuff, which in America you do in your prerequisites mostly. Because
Mhm.
here you just directly go into the degree and you start working. So I think it's more focused here, and I do like the system here. So that's how I kind of started with it,
Mhm.
and then I started really loving it, and yeah, now I'm here.
Okay. And as you were working in, you were a full-blown dentist while you were in India, is that correct?
Yes.
Okay. What made you switch to the States?
My brother was here, first of all. He was working here. And in India, the thing is that it was, I would say, there was a lot of saturation of dentistry in the urban areas. And uh, it's not in a very critical way, but to be honest, there was the regulation
Mm,
uh, of dentistry is not up to the mark,
mm,
and there was like a boom of dental graduates lately. So it's the education part is really great and it's amazing, but the opportunity part was
I
a
know.
little difficult for our generation of dentists.
Mm,
The dentists, I would say, maybe 3 4 years before us had great time
mm,
and a lot of opportunities, but they start to get um, thinner and thinner with time because of a lot of multiple factors. And I did not see a lot of future in dentistry there.
mm,
So I kind of came here to test the waters, and I did some certificate graduate programs. And when I did those, I realized I really want to move here because it was it's very competitive to get in here and do anything here, but at the same time it's also very rewarding, and the opportunity wise it was really good.
Mhm, mhm. Now, how was the move, professionally speaking, as a dentist in India? What is the process from moving from there and being able to practice in the States?
The process is so are you asking me the specifics, like how what you're required to do? And
Yeah, so you have to go into, so you had to do some training. What are some of the trainings you had to do, and what any exams you had to take to essentially be able to be a dentist in the States?
yeah, so to be registered as a dentist in United States, so every state has their own dental board and they have their own set of rules. But there are a lot of ways that you can acquire your dental license.
Mhm.
Uh, the most common path is to do the DDS again. DDS is just a dental degree, the professional dental degree here, and they have special program for foreign trained or international dentists, uh, which are 2 to 3 years, and there are a lot of prerequisites to get into those programs. So that is a separate class which has a condensed uh, courses for students, and what they do is that they throw you in the clinic with the regular DDS students also. It depends on the schools per se. So you have to get into that program, but to be accepted, there are a lot of exams that you have to give. So one of them is the dental boards. It's right now it's called the INBDE, Integrated National Board of Dental Examination.
Okay.
Uh, it, when I did, it was part one and part two. There were two parts. Now it's integrated,
Mhm.
and it's just a pass or fail exam. So you have to have that. And the second exam nowadays it's optional, but a lot of colleges are asking it. It's called ADAT, Advanced Dental Aptitude Test, which is scored. It has a score and it has a percentile ranking, which helps you. It is usually designed. It's actually designed for uh, dental students, the regular dental students, or the domestic dental students.
Mhm.
To they give that exams, and a lot of residency programs ask for it.
Okay.
And then there is uh, the English aptitude, which is usually the TOEFL.
Mhm.
Uh, I think test of English as a foreign language. That's the full form
Mhm.
of that. So you give that exam, and after that you apply to these programs, and then you get what do you call calls for interviews. So in the interviews, they interview you. Then there are so different colleges have different set of interviews. They check your hand skills. Most of the schools, there's only a couple. I think Boston doesn't have a hand skills exam, and I don't know any other program if they have it or not. But everybody has a hand skills exam in which they test your uh, skills on you. You have to make some cavity preparations and crowns on plastic teeth inside a mannequin, which is graded later. And then there is a one-on-one interview usually, either one-on-one or there is a panel of a couple of faculty or more. And then they do also look at all your profile, what you have done, your community service experience, your research experience, and your teaching experience or clinical experience if you have had any, and any awards, or everything counts. Everything counts. A lot of variables, and usually the acceptance rate is 2 to 3%. I mean, if
Mhm. Mhm.
1,000 people come for 20 seats, I was very lucky that I got in. But yeah, that's the whole process.
Right, that's a long process. It's I'm glad you're on here because I have been wanting to sort of, because I'm an immigrant as well, but I came here early enough wherein I didn't have any professional degrees back home that I needed to convert. But I have seen folks go through the process, or at least I've heard of folks go through the process, and it's very daunting. So congratulations on going through that and coming out on the other end.
you.
I know folks who switch careers altogether, just because the process is so daunting that they're like, it's just better to just start over again on another field. But thank you for taking us through all of that. Um, Now let me ask you a basic question, which is a little less like heavy, and that is, how would you describe a dentist to somebody on the street who maybe never heard of it?
Hmm. Dentist is a healthcare professional who uh, takes care and help you maintain your oral health. I think that's pretty simple.
I like that. I like that. And what are some of the scope of practice for dentists? Besides the teeth, so you guys are doing everything as it relates to the teeth, right? Are you doing anything as it relates to the jaw?
Yes. So
Yeah.
so the scope of practice. So there's a lot of focused scope of practice. Teeth for sure,
Hmm.
and gums. It's
Hmm.
pretty easy, and
Right.
then we have a lot of overlapping with head and neck and other people. So we have uh, around 8 to 10 specialties, and
Hmm.
there is so general dentistry is just the teeth, doing basic uh, restoration and rehabilitation of the teeth and not having teeth, mostly that part.
Hmm.
And part of oral exam is also, say, you examine and see if there is any signs of oral cancer. But if we find it, we would either send the patient to an oral surgeon who's a specialist dentist, or an MD head and neck or a bigger hospital, because we are not equipped and we are not trained to do those surgeries as general dentists. So that's one thing. I'm just giving you an example. And then we have prosthodontists who go into if somebody has some sort of uh, uh, they make the dentures and the crowns and all that. They
Hmm.
also restore the implants. You know what dental implants are?
Right.
So dental implants are they are titanium screws. I'm just using layman terms, which you can put in the bone, and the bone grows around it, accepts it, and becomes stable. And on that screw, you put a crown. So prosthodontist, so the person who places that implant, could be a general dentist, could
Mm.
be a periodontist. A periodontist is the dentist of the gums. Peri means around. Odontist means of the tooth. So everything around the tooth is taken care of by the periodontist. And the implant could also be placed by an oral surgeon.
Hmm.
And other specialities can also place it, but these are, I would say, the major specialities. And so amongst dental specialities, also there is a very minute overlap.
Hmm.
But yeah, the scope of practice is pretty much the mouth.
Hmm.
And yes, jaws are also taken care of. There is a specialty called the orofacial pain and TMD pain. TMD is temporomandibular joint. It's this joint right here. Uh, people get jaw pains while opening and closing, and it's a very complex joint. And because we also understand the concept of occlusion is how your teeth should come in contact, which actually gives us a better understanding of how the jaws would work, anatomy and all the aspects of it. So, but it's still very complex, so that's why we have a separate specialty for that. And then we have oral surgery. It's a 4 to 6 year program, depending on. So they, after DDS, you also get an MD. There is an MD program, or a regular oral, yeah, or a regular oral surgery. So it's 4 to 6 years. If it's a 4 year program, you don't get an MD degree. If it's a 6 year program, you get an MD degree. It's you do all the pretty much difficult surgeries and reconstruction of the jaw. And so yeah, I mean, the scope of dentistry is pretty widespread, and there are a lot of things that do overlap with the not per se directly medical field, but there has to be a lot of coordination between the medical doctor and the dental physician or the dentist, because it's the mouth is the teeth are in your mouth, and the mouth is on your head, and the head is attached to your body. So
Mhm.
they do have some sort of interaction. So yeah, I think I answered your questions, correct?
Yes, you did, and you actually answered a few others I was going to ask.
Oh,
But one I will ask to sort of you touching a little bit is what is the most common work settings that dentists work in?
so dental work setting is a dental clinic.
Mm-hmm.
There is the dental chair. It's a specialized because you have to make the patient comfortable, and the dentist also. So you lay them back, and they have to have an assistant, a dental assistant, who helps them with passing the instruments, and so that they're more focused at the patient.
Mm-hmm.
And uh, there is usually a front and the back, usually a front reception, which also takes care of scheduling and calling the patients, checking them in, checking them out, getting their appointments, and making a log of the billing and everything. The back office is a dental lab, which we use instruments. Most of the dental appointments are procedures, uh, and they take really long. I
Mm-hmm.
mean, in a medical setting, if you go, it takes like 15 minutes, sometimes 10 minutes. There's nothing like that in dentistry. Even an exam takes usually, it could take half an hour,
Mm-hmm.
depending on how much the patient needs your time. So, and even in exam, you use instruments that have to be sterilized. So the back office is responsible for sterilization. They wipe the whole room, the whole operatory is wiped, and for the next patient to get ready. And their dental assistants who bring the patient in, seat them, take their medical. I mean, a lot of yeah, their blood pressure and everything, the vitals and everything is checked. And after that, the dentist comes in. The dentist reconciles or looks at the treatment plan, delivers the treatment or whatever appointment that is for, and that's how it goes. So on an average, I mean, there are always everywhere high volume and low volume practice.
Mm-hmm.
If you consider low volume practice would be like seeing, I know people who only see like 5 6 patients a day, but they do big treatments, they take longer,
Mm-hmm.
they bill a lot. And then uh, my usual, because I work in a community setting, I also want to help more people. uh, and we usually see like 20 25 patients a day, which is very high volume.
What is what are some of the challenges you face working in a community clinic specifically?
The biggest challenging aspect is, I think, so first of all, the population here is Spanish speaking, so it's very easy. I have a lot of dental assistants who do help me with translation. Because I've been here for 3 years, I have my dental Spanish in order now. I can talk to them, and that was one of the challenges that I kind of faced.
Mm-hmm.
The second thing is that it's the cultural aspect. They have different kind of cultural values than ours. They think, and they think of teeth differently. um, they don't understand why do we have to check their blood pressure, and why can't we do some certain type of treatment, because we don't want to put them under stress. And it's mostly education, and I would say there's a difference between what you need and what you want.
Mm-hmm.
So you might need a certain type of treatment, but you might not be wanting it. And to make you understand that you need this more than the other is the difficult aspect. and I would say affordability. Uh, there's a lot of times that uh, some sort of treatments which it's a difficult extractions mean taking the teeth out. Yeah, bless you.
Thank you.
uh,
I was holding it for so long.
so yeah, taking the teeth out, if it's very difficult, but they cannot afford to, their private pay, and they cannot afford to go to the specialist, then trying to help them out doing difficult procedures is the main problem. And that's one thing that also motivates me to actually take up some courses and do more dentistry here, which could be more specialty focused. And I'm also giving it a thought of getting into periodontics residency program maybe in a couple of years,
Okay.
because that's something that I really think I really want to do.
Hmm. Would
uh,
that is that something you've noticed will be a very useful tool in helping the population you're helping with now, or is that just part of your professional development?
It's pretty much both. So while practicing, I realized that I have that kind of a personality that I would want to do everything too perfectly,
Mm-hmm.
and you cannot give that kind of quality as a general dentist. I mean, there are a lot of general dentists who are brilliant and who do a lot of work, and they're much better than what I do. But it's just my uh, personality also, and on top of that, I realized that all the other aspects of dentistry I'm more interested in periodontics for sure,
Mm-hmm.
and all the other aspects of dentistry I can somehow help the patients with. They're able to find those specialists. In my region there is no periodontist who would take the medical insurance or the insurance that the patients need. So later on, if I become a periodontist, I would try to come out and help or work in community clinics once a month or twice a month. You can all bundle up, because it's not that all the patients need it all the time. It's like many patients need it sometimes. So, if I can do that later on, that'll be great. And I also have interests in teaching and academics. So, that will also help me with
Mm-hmm.
that.
So now we talk about a lot about the challenges. What are some of your favorite part about working as a dentist, or specifically in this community?
Um, it's just that over time you kind of develop some sort of relationship with your patients, and you have uh, I mean, I think it's a dental, doing dentistry, doing those perfect or nearly perfect dental work, and that is one exciting part that you want to really get better at that professionally. That's really good. But at the same time, it has a huge people factor to it. So developing that kind of relationship, learning more about the population, the culture, and that is something that really excites me too. And I mean, living here, there's a huge Hispanic population. I have learned a lot about Hispanic culture because I'm trying to understand my patients better too. So that's some part of it that really it's a people's job, and you interact and learn, which actually makes it really special too, because that builds more trust between
Mm-hmm.
you and the patient, that you mean well for them.
Mm-hmm.
If you're making an effort to learn their language, to learn about their food, there's so many other aspects to it. So that really excites me and makes me really happy and want to work more.
Mm-hmm.
And yeah, so these are the two aspects.
From what I'm understanding, if you need to change or need or want to change specialty in dentistry, like within the dentistry as a profession, you're essentially going back to school and specializing in that, right?
Yes. So
Okay.
depending on what specialty you want, it could be anywhere from 2 to 6 years. And if you want to become an oral surgeon, it is 4 year to 6 year program. If you want to become a periodontist, it's usually 3 year program. If you become a prosthodontist, it is a 3 year program. And if there is a dental public health residency now, which is a 2-year program, or to 1 to 2 year program depending on schools. And then there is dental anesthesiology, which is also a 2 years program. And
Okay.
then there is uh, orofacial pain, which is a 2-year program. Then there is oral radiology, which is again a 2 to 3 year program depending on the school.
Mm-hmm.
And then there are residencies in general dentistry. There is hospital dentistry, in which you cater to a population which is admitted in the hospital, and you work on patients on operating room. There are patients who cannot be treated in a regular dental setting, so they have to be put up under general anesthesia,
Mm-hmm.
and you work on them. That is hospital dentistry or general practice residency, GPR. And then there is a general dentistry specialty, which is AEGD, Advanced Education in General Dentistry. I think I covered pretty much all the specialties. So that's how you go back to school and you do those certificates, and then you uh, clear their respective boards, and you become mean all the prerequisites. Then you get a license to practice as a specialist.
Okay. And you touched on something I wanted to ask you. Now, is it do dentists work in hospitals, and is that majority of dentists outside of the hospitals versus inside the hospitals?
Yes, so dentists do work in the hospitals too,
Mm-hmm.
because you can have an emergency,
Mm-hmm.
which somebody got a gunshot wound, and the gunshot wound is in their face, and they want somebody to look at, suture that. It's usually a medical provider, a surgeon. A lot of oral surgeons and general practice residents, they also work with that. I actually interviewed for a job at an Ivy League hospital,
Mm-hmm.
and they wanted to. Before I got into this job, I was not very competent, but there was a general dentist who interviewed me, who said he would, treat all those kind of cases, because they do need a dental. It's not that they were the sole people treating it; they were part of that big team,
Mm-hmm.
and you do need some sort of a dental or an oral health practitioner's input.
Mm-hmm.
Uh, so that's why we have that, and a regular the inpatient uh, who are admitted patients in the hospital, they also need to look after their oral health, which is usually done by dentists. So there is hospital dentistry. It's another uh, specialty, you can say, and there is a 1-year residency. It's called general practice residency, which you can actually do for 2 years too. And yeah, you can work as a hospital dentist.
Okay. Okay, that's good to know. And what right now, what are your shifts like?
So I work 10 hours Monday to Thursday, 8 to 7. And
Okay.
you have to do one Saturday. I work that as an extra shift a month.
Okay, which
Uh,
leads me to the next question.
yeah.
How is work-life balance right now for you?
Work-life balance is it's pretty good actually. I do cycle a lot. I run, and uh, it's really hot, so I have stopped. And you know, on the weekends, yeah, we do hang out. Last night I was with my friends. I did work extra shift yesterday. I
Mm.
worked 8 to 5, and then came home, changed, went back to friend's house. We hung out, and it's pretty good. I would say I think I can work more. It's just because I really like what I do.
Right, right. Oh, that's good to hear. That's good to hear. It's nice to see a happy practitioner. Um, and what other professional projects are you working on, or have you worked on, either outside of dentistry or in combination with dentistry?
So as I mentioned, I worked on a nonprofit. I did research, a lot of research, and that's one thing that one of my I just want to make a difference. I
Mm.
just don't want to invent or discover something or nothing like that. I just really want that we bring out some change. I worked a lot on antibiotics, antibiotic prescriptions in dentistry. It's very hard to change somebody's habits, and I worked on that. There are some conditions in dentistry where we overprescribe antibiotics, and slowly people are catching up to it. That's one aspect. Then I worked in. Uh, have you heard of what dental composites are?
Mm-mm.
Dental composites are it's a plastic material which is a white filling that we put after we take out the decay, or you know. So I
Okay.
did some research on that and how crowns are made, uh, the preparations and all that, how to work on skills, and then I also did some sociological studies in education on cultural competence. I gave a lecture in Stanford also in one of the conferences
Mm-hmm.
about that. Uh, and Lately, I've been working on. I see a lot of anxiety in patients,
Mm.
COVID and anxiety. So that's one thing I'm really uh, interested in. So we're working on a case series right now. I'm working with people from NHS in UK. So I do work internationally, and all my research has actually exposed me to really, great, amazing people who are also driven in the same direction. So, everything, the public health aspect of it, and uh, I mean, it's just that I would say I'm genuinely curious, and I really do want to uh, understand how things work and make them better for everybody. So that kind of uh, makes me more interested in working uh, on these side projects.
Mm-hmm.
So these are coming focus now. Yeah, go ahead.
Mm-hmm. That's exciting. And as I mean, in a way you already talk about that a little bit, but what are some leadership opportunities in as a dentist that are available for dentists?
Leadership. So all the dentists, I think, and
Mm-hmm.
I believe, are leaders, because if you have even your own practice, I have to kind of work with my back office, my front office. So you have to lead everybody all the time, and just make it a good service experience for the patients. So to begin with, you have to be a good leader, and after that, you could become a business owner. Uh, you can get up in the hierarchy of a corporate structure. Like right now, we're working in a corporate dentistry clinic. I'm a staff dentist. The next is assistant director, and after that, there is the director in my setting. And then if you go in the academic setting, it's kind of similar. You start from the bottom, and then you can go up higher to being the dean.
Mm-hmm.
And if you look at the organized dentistry, the American Dental Association, state dental associations, you can also become a part of that. So there are a lot of leadership opportunities in dentistry, um, which I think I've answered to your questions, right?
Yes, you have. And that leads me to the last question, which is, do you have any word of advice or encouragement to anybody wanting to become a dentist? And more specifically, anybody who is an international dentist, because that proves to be an added challenge in the field.
Yeah, I know. I pretty much speak to so I used to get a lot of requests um, from international dentists. I When I was preparing for my national boards myself, I started writing on Quora. Have you heard of Quora?
Yes, I have. Mm.
Yeah. So I at one point became the most viewed writer there, and a lot of people still read my stuff, and they try to get in touch with me. They have questions, and I spoke to somebody just last week, and I was getting so many requests that I have set up a time. Every Sunday night I have a 1 hour time where people can book a 15-minute slot. It can go over 15 minutes, and I can call them any other time of the week, or they can call me, and it's a very easy going, and we are very flexible with it. But I had to set it up because there were so many requests and people wanted to talk all the time.
Right.
So one biggest advice is that first of all, uh, always everybody is different. Most of the international dentists, they just feel that it's just a checklist or a laundry list that you have to have. Like, I have to have 2 years of community service, I have this, I have that, and I have to have 5 publications. I have to have these many presentations. I have to have these many awards. I have to have this much score here. And there's so many variables. It's not who you are. I mean, who you are on paper is important, but it's not everything. And there are so many variables. You cannot say that this thing here will help. Everybody has their strengths and weaknesses, and everybody wants different things in life. So you have to look at both the aspects and think of a path that suits you the best. So, and that, I mean, I've helped a lot of students, a lot of individuals. I wouldn't call them students. I've helped a lot of individuals with choosing and getting through what their goals were, what they really wanted. And you are more driven when you realize how you want to do it and what you really need. So my biggest advice is that don't look at your competition or your peers and think that, oh, this person has done this, I have to do that too. Don't compete. Just find what you really need and you really want, and then go forth with it. So that would be my advice.
All right. Thank you. That's great advice. And I appreciate you for joining and taking your time. Thank you for being out there and doing your thing and helping folks. For somebody who once needed mentoring, and I will hardly say that there's ever a time in my life that I didn't appreciate some, you know, getting advice for somebody who's somewhere I would like to be. So I appreciate you taking that time and leading the next generation and so forth. Other than that, if you don't have anything else to add, that is all I have for you today. Thank you for
Thank
joining
you.
me.
Thank you. You're very kind, Sinan. It was such a lovely talk. I look forward to our episode, and I've started watching, or sorry, listening to your podcast, and it's a very informational and interesting podcast. Sometimes I do listen and I do learn a lot. So thanks for doing it. You're doing a great job.
Thank you. Thank you. And thank you for taking the time. Have a beautiful weekend. Rest up because you're a busy man.
Thank you.
All
Have
right.
a wonderful Sunday. Bye-bye.
Bye.
All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.